Together again, at last. These were the scenes at Sydney Airport in early November when Australia reopened its international borders after almost 600 days. The country's zero COVID strategy came at a cost. Melbourne, capital of Victoria State, had 6 lockdowns. But as the state reaches its 90% vaccination target, life's now becoming difficult for the unvaccinated. Only those who've received the jab are allowed to visit restaurants, gyms and most stores. I'm Ben Fazulin. Hi. Australia's always been cut off from the rest of the world, but during the pandemic, it literally closed its borders and stopped most people, including me, from coming in or going out. As a result, COVID has hardly touched the country, but Aussies have had to endure long lockdowns.
Barista Theo Rosus is finally back at his espresso machine. Melbourne is just waking up from its 6th lockdown, which lasted 260 days. During that time, Theo had to lay off 20 employees. Now he hopes to be able to start hiring again.
If you look at it from saving numbers and keeping the COVID cases down, absolutely worth it. From a business perspective, the opposite, because it wasn't worth it. Obviously, the help was just to keep us open or functioning, to be able to open. We made no money during the lockdown, no one did.
Meanwhile, his client Nick Deftaros is fed up with lockdowns. He says many people have suffered mentally from the restrictions and sought refuge in alcohol or lost their jobs. No one's talking about that side of things.
You know, people's freedoms have been taken away. Some people have willingly thrown it away, very restrictive on movement and everything. It's pretty much like an open-air prison here in Australia.
A few houses away, hairdresser Darren Williamson has his hands full. He's glad the government was so cautious because he suffers from an autoimmune disease. Catching COVID could have been fatal for him. He thinks it was a smart move by the government to relax the rules in line with certain stipulations, like the recent vaccination requirement.
It's been a very difficult couple of years, but with the high vaccination rate, I think it's motivated people to get vaccinated because we want to get out of it more, and I think that'll stand us in good stead for the future.
The city of Melbourne was growing rapidly before the pandemic. Now many people have moved away. Captain Jimmy Gantidis has only worked a total of 3 weeks in the past 20 months. We're his only guests today. Australia enjoyed revenues of around 28 billion euros a year from overseas tourists before the pandemic began. But up until now, non-citizens were not allowed to enter the country except under special circumstances.
By New Year, I hope international travel comes back. Tourists come down, people having parties again. That's what we need. People to be happy, to be free, to live life. Don't be scared. That's what we want, back to the way it was.
Meanwhile, Theo Rosus would like to reopen his indoor area to guests, but one thing worries him. From now on, he has to check if his customers are vaccinated. If he doesn't, he could face a fine of up to 70,000 euros.
The culture down here has never been that way. It's always been our doors are open, wide open for everybody to come. And again, if I had a choice, I would accept vaccinated and unvaccinated people. That would be my choice.
In Melbourne, they hope that this time the lockdown is now finally over. At the beginning of 2022, Australia is expected to open up again to tourists from Europe. And when it does, Melbourne will welcome them with open arms.
But will those arms have been vaccinated? Let's talk about Australia's policies with Catherine Bennett, who heads the Epidemiology Department at Deakin University's Faculty of Health in Melbourne. Historically, a country of petty criminals and, as we heard there, an open-air prison, according to some. I mean, what sort of good or harm has it done, locking up all those Aussies for so long?
Oh, it's had very different effects on you depending which state you live in. Victoria's really had the hardest run with this and the longest time in lockdown, of course, and the most severe lockdowns with also the highest fines and penalties associated with it. And so you find people that actually are now still, even though we're opening up, scared to leave home because they think if it requires that level of restriction that they should still be worried. And there are others who were over lockdown a long time ago, and we saw that in protests. And so try to manage expectations, keep people in the middle where we're still doing things safely, but also allowing for the fact that we've got people with very different views and very different experiences in the population.
Catherine, what's your assessment? Did zero COVID work?
Well, it kept our infection rates, even in Victoria, the most troubled state in terms of waves of infection. We're still looking at an infection rate of something like 1.5% of the population, very low. And of course, we kept our death rate incredibly low by world standards. So that did work. Whether we did it all as perfectly as we could, I think we need to do a lot of evaluation work to really understand where we could have pulled back a bit and still had that same outcome. But what has happened in this year is we started off very slow with our vaccine rollout, probably partly because we did have this almost complacency with those international borders closed. But once the virus, the Delta variant, came on site and we had to deal with it and knew you couldn't close it down easily as we had previous variants, that then was a game changer. And that then pushed our vaccine rollout to now, amongst some of the highest rates in the world from something that was very slow starting. That's been a good outcome.
And that small percentage of unvaccinated?
That's right. There's still, in some states and territories, we're getting down to very low numbers. Some states, less than 5% of people 12 and over. Our two most populous states, Victoria and New South Wales, are looking to be well under 10% of people 12 and over vaccinated. Other states are a bit slower. We are seeing in Victoria that 2/3 of our current new cases are people who are unvaccinated. So we're hoping those numbers will be small enough, and of the people remaining unvaccinated, that there will have been a number of people who have had the virus by now and actually be, have some natural immunity. So hopefully that division based on vaccination status will become less relevant as the numbers are very small of people who don't have any immunity.
And does it help that summer's there now? The fact that UV light is a lot more abundant down under.
Yeah, well, that's right. And I think, the timing has worked for us where we've rolled out just coming out of our spring. And in fact, it means that at the time we started to open up in New South Wales and Victoria, 50% of people were still within the first month or two of their second dose. So we've got that booster time where you get the best outcomes from your vaccine, where you've got the best protection from onward transmission, not just serious illness, but any infection. So we've got the benefit of that as we wind into summer. And as you say, there's a lot of things about summer, including a tendency to mix and meet outdoors more often, to be able to use outdoor areas in hospitality. And so I think we'll, like the rest of the world, enjoy a slightly less pressurised period over the summer anyway. And then we'll be looking at our booster program going into early 2022 for the general population as well. And that should set us up, I think, well for autumn.
Catherine, one more thing. What about protecting businesses? We heard in that report about all of these small businesses and bigger ones too folding during the pandemic.
There has been a lot of support for businesses trying to keep them going. We know that the stress, the financial stress for the workers as well as the business operators and owners is enormous and is a big public health problem in its own right. So there has been a lot of work to try and keep businesses holding together, JobKeeper programs so that staff could be paid. And so that's the reality that will hit now, though, as people start to open up. We do actually need people to be getting out and participating in retail and in those businesses to get them back on their feet. So I think it's one thing to survive, it's another thing to actually have a profitable business. And so I'm hoping that as we do open up over summer, we do it safely, and that helps these businesses get back on their feet, because it's been a devastatingly long series of lockdowns. I don't know what the count is. I think it's 270 days in Victoria, so an extraordinarily long time to try and survive without, with disrupted business, disrupted schools, so much going on that we now have a long recovery from.
Catherine Bennett, Deakin University, great to have you on the show.
Thank you.
Germany's Vaccine Advisory Committee, known as STIKO, is now recommending COVID-19 vaccine boosters for all adults. This comes as the number of infections in Germany hits a new record. The committee says the top-up shot should be administered with either the Moderna or Pfizer-BioNTech vaccine. It said a booster should be given 5 to 6 months after the last dose. Time for our science correspondent Derek Williams and a viewer question about comparing vaccines.
I am vaccinated with Johnson & Johnson. Am I less protected than if I had been vaccinated with another vaccine?
Well, that depends on which vaccine you want to compare it to. And straight-up comparisons are tricky territory anyway. So in addressing this question, I'm only going to focus on what the Centers for Disease Control said about the topic in a publication from September. Now, in this big study, the researchers didn't look at how effective the 3 different vaccines approved in the US were at preventing breakthrough infections overall in those who were vaccinated. Instead, it took a stab at estimating risk of hospitalization when an otherwise generally healthy, vaccinated adult somehow got infected with COVID-19 anyway. And since risk of hospitalization has become a really key metric as our stretched healthcare systems head into another pandemic winter, that makes sense to me. I think that the most important takeaway was that although the vaccines approved in the US provided varying levels of protection against hospitalization, for all 3, that protection was still considered substantial. In percentage terms, however, vaccine effectiveness was estimated at 71% for Johnson & Johnson and around 90% for the 2 approved double-dose messenger RNA vaccines. The authors therefore said that the data indicated they provided more protection than the single-shot Johnson & Johnson vaccine. But they also hastened to add that there are several limitations to the report, not least that, as I said, it looked only at hospitalizations and not overall vaccine effectiveness. Another important thing to remember is that in many countries, people who got the Johnson & Johnson vaccine are now being urged to get a booster within a couple of months. And that will almost certainly increase protection in recipients even more substantially, at least in the medium term.
So nice to have you along. Stay safe and see you again soon.